going to get you off to sleep now, okay?
In operating room number 1 at UCLA Medical Center,
You may feel a little pressure here on your neck as you go off to sleep.
a woman is about to undergo a revolutionary new kind of liver transplant.
Pleasant thoughts, and we'll see you in the ICU, okay?
Without it, she could die in 6 months. But it's not just her life on the line.
70.
Because this woman's new liver will come from a living, breathing donor,
Nice deep breath.
her twin sister. All across Los Angeles, operations like this are redefining modern medicine and pushing the limits of technology.
Okay, we're gonna move you into the scanner now.
LA is home to 119 hospitals and more than 25,000 doctors,
A little faster.
all of them searching for new breakthroughs that will save lives
ESOP, in.
and maybe even produce miracles
Okay.
as they venture out onto the cutting edge.
We're going to load up. Okay.
40-year-old Debbie Benedict and her twin sister Carrie Kittinger are about to have an operation.
Bye, John.
They came 230 miles from Las Vegas to go to UCLA Medical Center,
Okay, bye-bye.
We'll see you.
one of the few hospitals where doctors perform the cutting-edge living donor transplant. Debbie, a mother of 3, will give up part of her liver to help save Carrie's life.
East, right?
But she's gambling with her own.
Oh, I'm extremely nervous. Extremely scared. You know, because I'm confident, but then you have the doctor, you know, he's reinforcing that, you know, this is serious and that, you know, there is a percentage that you won't make it and, you know, because he has to tell me all that. I'm like, really, I don't want to hear that.
Carrie, who's also got 3 kids, is just as worried.
Well, I go in and out of emotions. You know, like this morning, I was just lost it, thinking that my kids I wasn't going to see them again.
Carrie is a reformed alcoholic. Until 2 years ago, she drank up to 12 beers every day.
They're letting you over.
It affected her health and her relationship with Debbie.
Once I started drinking, it just kind of, it was off and on for several years, you know, and it just grabbed a hold of me. And I let my closeness with her, like, diminish, you know, kind of stay away from her because then she'll know what I'm doing. Debbie, do you remember which building?
Well, that's a 200 right there.
Okay.
UCLA is ranked as one of America's top hospitals. It's located in the heart of a sprawling campus of 30,000 students, and it has the busiest liver transplant program in the nation, with more than 200 of these operations done here every year. In the fall of 1998, Carrie's alcoholism began to catch up to her. She felt weak and dizzy. Then her skin turned yellow and she started throwing up blood. So she went to the emergency room.
I was malnutritioned, I was dehydrated, I was everything. He couldn't believe I even walked in there. Couldn't believe I was alive or standing there. And then that's when they said that you also have liver damage. You have cirrhosis of the liver.
Bring it with a chair, please.
Cirrhosis is a disease where scar tissue affects liver function. It's sometimes induced by alcohol. Carrie's doctor warned that she would die inside of 2 years if she didn't stop drinking.
Well, the minute that doctor said that, that was it. I turned it off like a faucet and had no problems. I have no cravings, I have no desires, nothing.
But her liver was already beyond repair. She needed a transplant to survive.
Finally here.
The waiting list was so long, doctors worried she wouldn't get a transplant in time.
My portal vein is hanging on by a thread and I could bleed to death in a matter of minutes. So that's how I ended up here. Thank you.
Now her best hope is a daring new operation.
Thank you.
Thank you very much. Thank you.
Do you have your insurance card with you?
Yes, should do.
53-year-old Greg Brule and his wife Trish have also come to UCLA Medical Center in search of a cutting-edge treatment.
Same address and phone number?
Huh?
Okay, just
Greg can't write, he can't drive, he can barely walk.
So I need initials here and a signature there.
In 1996, Greg was diagnosed with Parkinson's disease.
Mr. Charles, let me go ahead and give you this information so I don't interrupt you.
Since then, he's become a prisoner of his own body.
This pain I have, I think it's from the drugs I take, dyskinesia. Just this the jerking movement. It's so bad, it's just on my whole back. I just, every movement I make is like pain. But I shouldn't be in this kind of pain. I shouldn't.
And he's at the limit of what drugs can do.
The bro?
Yeah.
Right this way, sir?
Parkinson's disease affects more than 700,000 Americans.
I'm calm. I'm just nervous because of the pain I'm going through.
Right in here, folks?
The disease stems from the brain's need for the neurotransmitter dopamine. Deep inside the brain, a chain of different structures use dopamine to control fine body movement. The segment shown in purple is called the subthalamic nucleus. Below is the region where dopamine is produced, the substantia nigra. This area is no bigger than a dime. As cells in this area begin to die off, the brain doesn't have enough dopamine, and some regions become overactive.
What did you used to do?
This leads to the most crippling symptoms of Parkinson's disease: stiffness, tremors, and chronic pain.
Well, today's a big day.
Yeah.
We can...
Some of the drugs prescribed for Parkinson's flood the brain with dopamine and help to restore normal movement. But high doses can lead to dyskinesia,
So you're all set.
I'm set.
where all the muscles are activated at once, and a patient can't stop moving.
Dyskinesia is just terribly painful today. It just goes throughout the entire back.
Yeah.
It's just like somebody
Well,
stabbed
your
me.
muscles never get a chance to relax.
Right. It's just boom, like this.
The drugs also become less and less effective.
Which of your medicines did you take this morning?
Greg has gone from taking 1 pill a day 4 years ago to 10 pills today.
Once I wake up and just start taking the drugs, the whole way over here, I bounce on the walls of the car. But the operation will alleviate all of this. So hopefully, I'll see the drugs and I can live almost a normal life.
It's the first significant amount of hope we've had in a while, so I feel very optimistic.
It's like been about almost a year now.
Yes,
Since
it's
I saw
August.
you, yeah, I was
10
here
months.
6 months ago.
Yeah, 10 months.
UCLA transplant surgeon Dr. Mark Gobriel first told Carrie and Debbie about the living donor operation.
All right. Let me check in a couple of things
Okay.
here, and then
All right.
we'll talk.
Okay, thanks.
Thank you.
At the time, Carrie had up to a 2-year wait on the organ donor list.
I think that living-related procedures are going to be the wave of the future because of the pressure of the ever-increasing number of recipients and not enough livers. Living donation is going to become more and more common as time goes by.
They're ready for you now.
There was a problem. Debbie was overweight, and her liver was 10% fattier than doctors would allow.
They said it was a no-go. So it was very disappointing and everything, but they said you could always be reevaluated. And then she faithfully found a good diet, a healthy one, exercised, swam, walked on the treadmill, lost 25 pounds, and that took off 12% fat out of her liver.
Hey, how you doing?
Good tomorrow.
Where are they?
But we'll have to see.
Okay, one more.
Dr. Ronald Buzatil has performed almost 3,000 transplant surgeries.
Oh my God, we got the whole family here. We do. Well, hi.
Hi.
Dr. Buzatil. So how are y'all doing? Are you about ready for all of this?
Yeah, I think so.
This will be just his 7th living donor transplant.
So how are you been? How you feeling?
I'm feeling, you know, a
Little nervous?
Nervous, yeah.
Can I take a look at both of you all? Maybe could you excuse us for just a minute here?
His other living donor operations have been successful, but there's always a risk.
I've got a normal, healthy person that I'm going to subject to an operation, and I'm going to take out 60% of their liver. That's a big operation for somebody who doesn't need an operation.
Yeah.
The surgery begins in less than 12 hours. All Carrie, Debbie, and their family can do is wait.
Thank you. Hero, you know that, don't you?
I was 6 when they were born, and it's always been Carrie, you know, pushing Debbie along. crawling, walking and all, and now it's Debbie that's helping her.
I want my old Carrie back.
I will be. I won't let you guys down. I promise.
I know we need
A lot of support, so how could I go wrong?
Oh, well.
Morning.
It's 5:15 a.m. At UCLA Medical Center. Debbie Benedict spends her last moments with her family before undergoing the operation that will give part of her liver to her twin sister, Carrie Kittinger.
We just opened the abdomen and we're going to have a look at her liver right now.
Dr. Mark Gobriel begins to cut through the outer layers of skin and muscle.
The right side will go to the recipient, and this is the part of the liver that will stay with her.
The liver is made of 2 separate lobes. In a living donor transplant, 1 lobe is removed. The remaining half actually regenerates within 3 months, restoring the liver to almost its original size. 2 hours after Debbie's operation is started, doctors prep Carrie for surgery.
When you wake up, you will not be able to talk because the breathing tube will prevent that.
Her thoughts are with Debbie.
They just told me she's doing good, that it's going as well as it's going like it should be. But I'm still worried about her.
Back in operating room number 4, doctors split Debbie's liver, but there's a problem. The liver has an unusual number of veins and arteries.
Usually there's 1 artery to the right lobe and 1 main portal vein to the right lobe. In this situation, there's 4. We got 4 hookups now to do rather than 2. So it's a little more complex than we thought it would be. Pull the artery out a little bit for me. Can you pull the artery out?
After 2 hours, Dr. Buzatil's patience pays off. The liver is ready to come out.
Okay. Come with me.
Oh, there it is. Get a good look at that.
The liver can be transplanted into Carrie for up to 24 hours.
Do you know where we are? Where they are? On the left.
That's good news for the family.
Oh, there you are. Hi. Good. Debbie's, we're all finished. Sure, not with your aunt. Right, yeah. Everything's done there, and everything went very well. Hi there.
I'm David, Carrie's husband.
Hi, I'm Dr. Buzatil. How are you doing? Carrie's doing fine. We haven't finished, but I just removed the liver from Debbie and part of her liver, and everything went very well. Doing fine, so you'll...
They're still in the middle of it right now?
Right, we're now starting to take Carrie's liver out.
Okay.
And I'll be up to talk to you probably in about 4 or 5 hours.
Okay.
Okay?
All right.
Good.
We'll be right here.
All righty. Very good.
Thank you.
You bet.
Debbie's daughter Danielle is grateful for the good news.
It's like flushed out of me now. I'm so relieved now. I think she's an awesome person, and I cannot believe she did it.
But Carrie's husband Dave knows there's still a long way to go.
Can't decide whether to stay awake or fall asleep. The whole world's down there laying on that table.
A few miles east of UCLA is Beverly Hills, a popular stop for discriminating shoppers and tourists alike. But just a few steps away from the high-end boutiques and high-priced restaurants, there's proof that being on the cutting edge of medicine doesn't always mean using a scalpel. The Beverly Hills Posture and Rehabilitation Institute is one of LA's havens for alternative medicine.
How's the pain today?
It's better than yesterday.
It's better?
It was established by Dr. Walker Ozar, a chiropractor who specializes in combining different medical disciplines.
What we do here is very safe. A lot of times what happens is I co-treat with medical doctors, and the person that's getting the benefit from that is the patient. If the patient can get, the best of both worlds from alternative point of view as well as a medical point of view. And usually that's just means the patient's going to benefit, which is the most important thing. Hello, how you doing, Gary?
He works with some patients to recover from operations,
How's the acupuncture?
while he helps others avoid going under the knife at all.
Problems at all.
Have you still been going to the gym and doing light weights?
I'm doing heavier weights now.
Heavy weights, okay, good.
50-year-old Gary Fishbein went to his doctor about a year ago, bothered by shooting pain and numbness in his arm.
He diagnosed it as having herniated discs, I think between 5 and 6 and 6 and 7 in the neck. And he gave me 2 choices. The choice was either to have surgery or to call Walker.
Over the last 10 months, Walker has put Gary through a regimen of acupuncture, massage, and traction therapy to cure his disc problems.
Okay.
Acupuncture helps increase blood flow and promotes healing in the back, while the massages break up the toxins that have built up inside Gary's muscles.
All right, Gary, that's enough torture for one day. Let's flip you over and do some traction therapy, okay?
I agree.
With traction therapy, Dr. Ozar pulls the spine away from the bulging disc.
And I started doing this on Gary from day one. This is probably one of the most important things to do for him.
That takes the pressure off the disc and relieves Gary's pain.
Gary, do you feel a little pain in there?
Just a little numb.
Okay.
My goal of coming here was to get back to doing what I used to do, which was playing ball and working out and, you know, trying not to act my age. And he did that. He got me to the point where I could go back and do all those things, pain-free.
All right, let's do some therapy on the muscles, okay?
Student athlete Jeremiah Pike had surgery 8 months ago to repair fractures in his mid-back. Dr. Ozar uses ultrasound to send a pulse of electricity into Jeremiah's muscles so that they fatigue and then relax.
Could be used for someone with knee problems, could be used for someone with neck problems. Anytime you're just trying to decrease inflammation in the muscles and relieve some of the spasms going on in the muscle tissue.
He also puts Jeremiah through acupuncture. Dr. Ozar's clinic offers a high-tech spin on this age-old procedure, electric acupuncture. These sensors connect with a computer that can produce different levels of heat. That heat brings fresh blood to targeted areas in the body.
This is just another modality for us to help use to loosen up the muscles, to decrease inflammation, and help the healing process.
A few miles south of UCLA, there's a new spin on the ancient practice of acupuncture. It's happening at the Daniel Freeman Memorial Hospital in Inglewood. This is already one of the top facilities in the country for stroke rehabilitation. In the first study of its kind in the United States, doctors will test the benefits of acupuncture on stroke victims. The study is being financed by a grant from the Center for Integrative Health, Medicine, and Research in Santa Monica.
Come on, you play football. Come on.
65-year-old Robert Alexander used to walk and bike 5 miles a day. Now he has trouble getting out of bed.
3 weeks ago, he beat me at pool. I mean, we were playing pool. We played 10 games. I won 2. So that was like 3 weeks ago.
2 weeks ago, Robert suffered a stroke.
Mr. Alexander, how are you doing today?
Doing okay.
Good. Robert's had a stroke that affected his brainstem, and he has a partial paralysis on the right side. Let's take a look at your hand here. Why don't you lift your arm up for me and try to hold it up? That's good. Now open and close your finger.
Dr. David Alexander puts Robert through a strict regimen of physical and speech therapy.
I feel uncomfortable when I'm speaking, you know, but otherwise I don't feel anything different.
That's good. Why don't you pinch my finger? Let me see how strong you are.
Throughout this process,
pull all your fingers over.
Robert will relearn basic tasks, like brushing his teeth and putting on his clothes.
Now touch my finger with your right hand, your right index finger. Touch my finger. Now touch your nose.
His therapy will include 30 minutes of acupuncture a day for 2 weeks, then twice a week for the next 6.
The study divides patients into those that get stroke rehabilitation as we usually do it, and those that get stroke rehabilitation as we usually do it, plus acupuncture.
I figure that all the help I can get, I'll get it.
Hi, I'm Dr. Ma. I'm from China.
Dr. Zhuling Ma is one of LA's most distinguished doctors of Chinese medicine and an expert in acupuncture.
Now we'll start the treatment.
Eastern cultures believe it improves circulation, strengthens muscles and tendons, and helps digestion.
Then 12 is the front move of the stomach.
Dr. Alexander will draw his own conclusions.
5.
Within 8 weeks, I think Robert will have improved use of his hand. I would hope that in 2 months he'll be able to use it to comb his hair, to brush his teeth, to pick up objects, to use a key, and have greater dexterity and something you can also see when you examine him.
Start for the needle out.
The findings of this study could provide great hope, not only for Robert, but also for the 4 million other Americans struggling to recover from strokes.
Okay, all done. Thank you.
No, there's more you have to know.
Dr. Antonio De Salas is a professor of neurosurgery at UCLA Medical Center.
Hello.
We got our plan.
Oh, good.
He specializes in treating Parkinson's patients like Greg Brule,
You took your pill at 6 a.m., right? I think I
people who
told
have
you.
nearly exhausted all the usual treatment options.
Right now, with the medication, he still can be independent at home. But when the medication stops working completely or have too much side effects that he won't be able to take the proper doses, then he'll be paralyzed. And how did it start?
Dr. De Salas is one of only about 30 doctors in the country who perform an amazing new operation called deep brain stimulation.
I walked a little long.
And the major problem is really on this side, huh? The right side.
Mainly, yes, both
In this
sides.
procedure, he will implant an electrode on the left side of Greg's brain.
You always will be able to turn it off if you don't like it, and then we can reprogram it.
Right.
This should help Greg control the movements on the right side of his body.
This particular surgery, I was done about 2 years ago. It was done first in Europe, very successful in Europe, very successful. And it's supposed to relieve almost all the symptoms. It's not just tremor, but all kinds of other things. So you do the left side of the brain today, right?
Yeah.
Mm-hmm. And about a month from now, it'll be the right side.
Yes, but if you come here and ask me to do so, because you may feel good with one side only.
Really?
Yeah. If you are fine with one side only, then I will not need to put the other side. Yeah, so let's try this side first, and if you are happy with it, we are all happy.
Well, I'm going to be ecstatic.
In just a few hours, Greg will find out if deep brain stimulation is the miracle he's been waiting for, or just a dead end.
We'll take good care of it, okay?
At UCLA Medical Center, Debbie Benedict begins to recover from the operation she underwent to donate part of her liver.
Open your mouth for me, Debbie.
Good job. Take some nice deep breaths for us. You're fine. Everything is all finished. You're going to go to the recovery room.
Doctors are just getting started on her twin sister, Carrie Kittinger.
Well, you know, we've taken the liver out, and then we've...
First, Dr. Ronald Buzatil removes Carrie's diseased liver. Then he implants the liver section he removed from Debbie.
That looks fine.
Yeah.
Let's tie it.
Yeah.
Debbie's liver had extra veins and arteries. This makes the surgery more complicated.
This adds, I would say, if you put degrees of complexity on a 1 to 10 basis, this 10 being the most complex, this is probably an 8. You know, I'm just hoping that everything is going to hook up together and everything is going to work, and we're going to be able to get this liver functioning, and we're going to get this patient to a new life. Hold the cave up for me, Dr. Gabriel.
Over the next 45 minutes, Dr. Buzatil connects the liver.
Need more ice fall.
When it's ready,
You know, right now it's looking great.
he restores blood flow.
I'm almost open, totally. You getting any T-wave elevation? You getting any bradycardia?
No.
You getting any widened QRSs?
Everything looks good.
The liver feels pretty...
Systolic pressure still 135.
The liver feels pretty soft still. We got a lot of arterial bleeding. We'll get that, put something on that.
In just a few minutes,
Let me have 5-0.
the liver is functioning. Dr. Buzatil finds Carrie's family.
Hi there, how y'all doing? Everything is almost completed. We've got the liver in, it's working fine, and just got to, you know, get her closed up. Everything went real well.
Oh, it's such a relief. I get the final word from him.
Yeah. Okay?
All right, thank you. Thank you
Okay?
so much.
Good. Okay.
It's a real honor.
Okay, thank you. You
Again,
bet.
like I
Okay,
said.
you bet. Okay. All right. So you'll be able to see her up in the ICU.
Okay.
Probably, it's going to take about 2.5 hours before you can see her. Okay. See you later.
Really excited and relieved. It's all over. It's been a long, long day.
At the Daniel Freeman Memorial Hospital in Inglewood, it's been almost 2 months since Robert Alexander began recovering from a stroke.
The stroke affected my voice, my complete right side, the arms, the hand, the leg, the foot.
Let me look at your eyes. Look right up at me here.
Under the guidance of Dr. David Alexander.
That's good. Now look at my finger and follow the finger.
Robert had standard physical and speech therapy.
Let me see you stand up and walk for me. Can you?
He's also undergone acupuncture as part of a new study on stroke victims.
Why don't you try the stairs? Let me see how well you do on the stairs. So this study is really to say, does acupuncture work within the confines of Western medicine by our scientific techniques? Can we show that it works as well as medications or physical therapy or something else? That's fine.
Since his treatments began, Robert has improved dramatically.
Robert looks great to me. He's made really good progress since I last saw him. Relax your arms, just like that.
In the past few weeks, I've noticed that I'm getting stronger in my arms. I'm able to do things that I haven't been able to do before. Like I could brush my teeth, I could feed myself with my right hand, and that's a big improvement.
Until the study ends in May of 2001, Dr. Alexander knows there's no way to judge what role acupuncture played in Robert's recovery.
Come on back now. For Robert, I can't tell specifically how much the acupuncture may or may not have helped him. It'll be an answer that we'll get from the aggregate data at the end of the study.
Okay, we're gonna move you into the scanner now.
Okay.
Back at UCLA Medical Center, doctors take an MRI of the brain of Parkinson's disease patient Greg Bruhl.
Film at 11.
Using these detailed images, they will begin to perform the cutting-edge procedure known as deep brain stimulation. It's a high-tech operation that overrides a malfunctioning part of the brain. A computer-controlled electrical pulse generator and lead wire are placed under the skin. Electrical signals travel up the lead into an electrode implanted in a key structure that controls movement, known as the subthalamic nucleus. In this part of the brain, shown here in blue, the two halves are overactive, sending out electrical bursts that prevent normal motion. The electrode overpowers the nucleus and shuts it down.
You don't cover his face, because we'll be talking to him.
When the MRI is done, Dr. Antonio De Salas clears a path to Greg's brain.
Greg, you awake?
Incredibly, doctors keep Greg awake and talking throughout this part of the operation, so they can make sure they find the best spot for the electrode.
Greg?
Greg?
Yes?
I can see your brain now here.
Oh, really?
It's a good brain.
Really?
Dr. De Salas studies the MRI of Greg's brain to close in on his target,
Just to go all the way to 10 above the target.
the STN, or subthalamic nucleus.
How big is the STN, you think, Tony?
About 7 millimeters,
So we
6 to
should
7
be close.
Precision is crucial.
Wonderful. Okay, now we go examine the patient.
After about an hour,
Okay, now I need the Medtronic electrode.
Dr. De Salas inserts the stimulator electrode in the subthalamic nucleus on the left side of Greg's brain.
Can I have that little white wire?
Then doctors give the electrode a charge.
Yell out your name.
Greg Bruhl.
Good.
Can you lift your leg up, please? Wiggle your toes up there, up in the air. Do you feel that this leg is better now?
Yes.
Open and close your hand real fast. Oh, that's much better.
Remember you told me that was very stiff, the right leg?
Yes.
Too. That's
Yes.
great.
For the next half hour, doctors move the electrode around in Greg's brain,
Okay, good. So we're in the right spot.
testing his reaction to find out where it works best.
All right. We found the perfect spot.
Wow.
Look at that.
Wow.
These are fast movements.
Well, now
you
we
haven't done for a
cement
long
the
time,
electrode
huh?
in place, so it
Yeah.
doesn't move.
Hey, look at him tap.
Dr. De Salas puts in the stimulator,
Can I have a silk stitch?
the electrode's internal power source.
Can I have some vasopressin irrigation pipe over me?
He tunnels a wire leading from the brain down into the chest and puts the stimulator in place.
It's coming from the brain and it's passing under the skin, coming out here.
After 9 hours, the surgery is complete.
We gave the stimulation in the operating room and it was perfect. So we feel that it was very successful. He looks pretty happy. All right, good.
Thank you so much.
Yeah, you're welcome.
Now the waiting begins. Because of swelling in the brain, the electrode can't be turned on again for 2 weeks.
What?
That's when Greg will know if the surgery has been a true success. 75 miles outside Los Angeles, in an area called Loma Linda, another cutting-edge operation is about to take place. This is where doctors transplanted the first baboon heart into a human in 1984. And they're on the verge of making history once again.
Well, Mr. Jink, doing all right?
Yeah, I'm sure.
You about ready to get out of here?
I sure am, yeah.
All right.
Dr. Stephen Gundry is the head of cardiothoracic surgery at Loma Linda University Medical Center.
We like to push the edge. We like to find out where heart surgery is going, and not only find out where it's going, but hopefully take people there. All right. You gonna walk around today?
Yes, sir.
All right. Very good.
For 30 years, there's only been one way to do a heart bypass, and it's a dangerous, difficult process.
Oh, Mr. Luco, how you doing?
For patients like Gino Luco, who had a quadruple bypass 2 days ago, recovery can take several weeks, or even months.
Can I just push on your chest here a little bit? All right. That's good. What do you got
That's
here?
because his chest was literally cracked open.
Well, we've got to get to Mr. Luco's heart. Traditionally, we go right through the middle of his breastbone. And so it ends up, for a coronary bypass operation, is about a 12-inch scar.
But that could change.
You all set to go?
As the future of cutting-edge medicine gets one step closer to reality.
Simulator all set?
A groundbreaking new robot may actually change the way surgeons operate.
Okay.
It's called Zeus. In less than 4 hours, 55-year-old David Yuntz will have a heart attack.
Okay, if you follow me, I'll take you to admission.
But he isn't worried, because here at Cedars-Sinai Medical Center, what could be a life-threatening crisis is a cutting-edge cure. Cedars-Sinai sits at the border of Beverly Hills, one of LA's most affluent neighborhoods. The hospital has its share of celebrity patients, but it also serves ordinary people from Southern California and around the country.
Good morning. Have a seat. My name is Shirley.
With his daughter Nicole at his side,
Have your insurance cards with you and a picture ID.
David has come 2,300 miles from Newark, Delaware.
What city were you born in?
Wilmington, Delaware.
David is an ex-Marine who has always enjoyed a healthy, active lifestyle. But now he can barely break a sweat without being utterly wiped out.
I can't golf, do long walks, flights of stairs. I used to like to take my dog and run with the dog. I can't do that anymore. I'm not going to take no body parts.
No, not this time.
His trouble started in 1992.
I was in the parking lot going from one office to the other, and I was walking. All of a sudden, I started getting dizzy and not knowing what was wrong. And then next thing I knew, I woke up and came to in one of my friend's arms. And then they took me in and did an EKG in the sick bay, and then I ended up at the hospital.
Do you smoke, sir?
No, sir. No, ma'am. Sorry.
Oh, that's okay.
Doctors diagnosed David with hypertrophic cardiomyopathy. It's a genetic condition that produces an overly thick heart muscle. This muscle, the septum, creates a blockage between the two lower chambers of the heart. The heart must pump harder to keep blood flowing. 1 in 500 Americans suffer from some degree of this condition.
They're going to come and get you and take you up, and good luck to you. My pleasure.
But not all of them are as severely crippled by it as David.
I like to be able to go up a flight of stairs, get back to where I used to be able to walk and stuff like that, you know, and not carry bags and stuff without breathing heavy and having to stop or sit down.
You could continue to take medications.
Right.
Dr. Raj Makkar holds the key to a medical breakthrough.
Students, if you can take in some deep breaths for me.
A daring operation called a controlled heart attack.
What I tell my patients is that if they are not responsive to medical treatment, to drugs that are traditionally used for their condition, undergoing this procedure is a good alternative to having an open heart surgery.
David will be awake for the entire procedure.
Okay, strain, David. David, strain, strain, strain. Very hard, keep it on, keep it on.
Dr. McCarr stimulates David as though he were running up a flight of stairs, inducing extra heartbeats, or PVCs, by passing a catheter through one of David's arteries and touching it to the inside of his heart.
Let's go ahead and give him a PVC.
Then Dr. McCarr measures the pressure in the heart chambers.
Please go ahead and record that.
The orange line shows the pressure in his left ventricle, the muscular lower chamber that pumps blood out to the body. The blue line represents David's aorta, the artery through which that blood leaves the heart.
All right, we'll go ahead and give you more PVCs here.
In a healthy person, the pressures would be at the exact same level.
Mr. Ewens, are you feeling short of breath, or do you have any chest pain at this time?
For David, they're not even close.
A little bit tightness.
You have a little bit of tightness, all right?
He hopes a controlled heart attack will make the difference.
The butamine is off.
The butamine is off.
Excellent, all right.
At Loma Linda University Medical Center, just outside Los Angeles,
ESOP, up.
The future of heart surgery has arrived. But this operation isn't being done on a real heart. It's a mechanical one.
We'll have this heart actually beating so it moves just like a regular human heart. In fact, there it goes. So we can really practice our skills and practice positioning of the instruments without harming an animal. And I think that's good for everybody.
It's all part of honing the cutting edge of surgery. As Dr. Stephen Gundry tests out a robot named Zeus.
Stop. Zeus is a robotic arm that we can communicate with via computer to translate our motions in our fingers and our hands to instruments that are passed through an abdominal cavity or chest wall cavity. And Zeus translates our motions to the instrument's tips. And it's as simple as that.
The Zeus surgical system is made of 3 robotic arms. Doctors insert them through holes in the side of the body.
Ordinarily, this is how I would be operating on a human heart. Sure.
One functions as a stabilizer, moving the heart around inside the chest.
We can put it in completely folded up.
The other 2 have surgical tools attached to them.
You can see the working arm, and here comes the instrument.
Zeus is more precise than even the most skilled surgeon.
ESOP, in.
Because it has greater dexterity than the human hand, and it won't experience tremors or get tired.
In.
For patients, it means that instead of a foot-long incision,
move back,
they would have only 3 puncture wounds the size of pencils.
The advantage is simply going into a world where we've only been with large openings before, and trying to accomplish a similar feat through little tiny openings.
Dr. Gundry can perform the entire operation from across the room.
Move back.
Using a controller that looks like a computer joystick.
Move in.
To know what he's doing inside the body, Dr. Gundry relies on the help of another state-of-the-art device. A fiber optic voice-activated camera called ESOP.
This is ESOP. ESOP is the robot that handles the scope. ESOP, move in. ESOP can get me exactly where I need to go to take a look at the inside of this blood vessel so that I can then move the robot to make a fairly precision stitch right where I need to go.
With Zeus as his hands and ESOP as his eyes.
ESOP, move in.
Dr. Gundry can do almost anything an ordinary heart surgeon could, from hooking up a new artery to putting in stitches.
Up, up, up.
This device would slash the recovery time on bypass operations from weeks
back
to hours, and there's less risk of infection through these tiny holes than if the entire chest is cut open.
It would be an outpatient procedure. They'd come in, we would bypass their blood vessel, and they'd go home later that afternoon and hopefully be back on the golf course the next day.
ESOP is already being used in operating rooms around the country.
ESOP, move back.
Zeus has started a 12-center trial, but only for procedures where the patient is connected to a heart-lung machine.
Back.
FDA approval for Zeus could still be 18 months away.
Right.
In the meantime, doctors will determine how effective it can be.
I have to be convinced, and most of my colleagues in cardiac surgery have to be convinced that on a day-to-day basis that Zeus, with these little tiny holes in the side of the chest, can reproduce what we do through this great big hole. And I think that's the question that still has to be answered.
Back in Los Angeles, at the edge of Beverly Hills,
We will be ready for contrast echo very soon. Let's get the alcohol open up, please.
in an operating room at Cedars-Sinai, Dr. Raj Makkar prepares the alcohol he will use to cause David Yuntz's heart attack.
We'll inject about 3 cc's.
Dr. Makkar injects the alcohol into an artery that leads to David's thickened heart muscle.
Can you inject a little bit more, please?
This dose of alcohol is strong enough to cause a minor heart attack in a part of the heart where one would never naturally occur.
Maybe a little bit more.
An echocardiogram helps guide the injection into the proper area of the heart. The alcohol is toxic.
Comfortable with some
No, not too
chest pain? Yeah.
I hope this is the time for it.
I'm sorry?
Is this the time for it?
Yeah, this is when you will feel the discomfort, sir.
It kills off the overgrown part of the heart muscle and relieves the blockage.
So I've injected about 3 cc's of alcohol, and that is where I'm going to stop.
Now doctors perform another test to measure the pressure on David's heart.
Give one more PVC.
One more PVC?
Yeah, we'll give you more PVCs again.
This time, the pressures in David's aorta and left ventricle are identical.
We are quite pleased with the outcome of the procedure.
Ready for pullback.
The blood flows freely.
You feeling all right? Yeah.
After 8 years of feeling out of breath and weak,
Okay, are you a little tired?
David will soon be back to normal.
In a few weeks, he should be able to walk more without feeling dizzy, and he should feel better in terms of his shortness of breath. So that's what I would expect.
Why don't you close your eyes and take a nap? I'll go back out and sit down for a little bit. All right. I love you.
Love you too.
2 weeks ago, Parkinson's disease patient Greg Brule came to UCLA Medical Center for a revolutionary type of brain surgery. At the time, he could barely walk.
How are you on walking?
Fine, fine.
Okay.
Good.
Let's head over and try and get you turned on.
Today, Greg returns to UCLA.
Let's get going here.
He meets with electrophysiologist Dr. Bob Freisinger, who turns on the electrode in Greg's brain.
Any sensation there at all?
Yeah. Uh-huh. Yeah.
Instantly, Greg feels more control over the right side of his body.
Okay, let's try standing up and seeing how that goes.
Okay. Wow. Amazing.
Yeah, I'd have to say I see a difference.
I feel a difference. Unbelievable. The left side is a little wonky. The right side is much stronger than it's ever been in a long, long time. So subtle, this comes on.
It seemed to me that we saw a huge improvement in his quality of life just in the first 30 seconds after we turned on the stimulator. And things are going to get, we know, a lot better than that before they start going in any other direction.
Amazing. Unbelievable.
Within hours of her liver transplant operation, Carrie Kittinger drifts in and out of consciousness. Then she starts bleeding internally.
We were getting suspicious after 48 hours after the transplant that the liver really wasn't starting to turn around and producing clotting factors and clearing the bilirubin and doing the things that we would normally expect a good functioning graft to do.
Unfortunately, as in about 20% of living donor operations, Carrie's new liver fails. She'll need another transplant to survive, so it's back on the waiting list. After 8 excruciating days, Carrie's family gets good news.
It was probably about 6 in the morning, and my brother-in-law said, I'm gonna go check on her, and he came down like 10 minutes later, just running up to us, like, I love her, you know, really loud, you know, people are looking at us. I mean, it's pretty exciting for us, so we were just thrilled, just thrilled.
When you retransplant somebody early on, the operation is actually simpler than the original transplant. So this was really a matter of catching it at the right time before the window of opportunity closed.
The operation takes about 4 hours, and this time there are no problems.
Well, everything looks like it's working fine so far.
Yeah. When do you want to get up?
Today.
Yeah.
1 week later,
Look at you without your makeup on.
Great.
Carrie's condition is stable, and her second new liver works perfectly.
What they told me was I got a picture-perfect liver. So she should be fine.
Debbie has been released from the hospital, but she's back to visit Carrie.
It's going to take some time. It's slow going, but every day I feel stronger.
As the women recover, they're reminded of how precious life and sisterhood can be.
I'm going to make sure that whoever donates an organ knows that they saved more than one life. And I'm going to live it.
Six weeks after surgery for Parkinson's disease,
To the left?
and a month since he had an electrode turned on in the left side of his brain, Greg Brule has noticed a change for the better.
I feel a lot more fluid in the arms. Go like this and this, isn't too tight. There was a time when I couldn't ever even do this or this. And, you know, I feel a lot more fluid.
Greg has also been able to reduce his drug intake by half. The medications that work for about an hour now last for 2 or 3.
I'm right-handed, and I'm starting to favor the right hand again after so many years of having to go to the left hand. And I feel much more movement in it. And until the drugs start to wear off, it's pretty good.
Greg says he feels happier than he's been in years.
I think primarily that I see a sense of vitality that I haven't seen for a long time. That's real obvious to me.
And the possibilities for recovery seem promising.
I feel like we're going to enter a new period where we have more of an ability to do things in life that we'd like to do, other than just day-to-day maintenance type of things. If we can take trips, if we can make some plans to do different things, that would be very nice.
I feel okay, but I still feel a little off. The left side's off. Right side seems a little more steady.
But Greg's stimulator has had its downside.
I lose my balance more now because the right side is pumped up with the probe. Left side, right side. And the left side, nothing's happening. So it's a very strange type of situation right now.
Okay, when I come up the stairs, I always have to grab onto something like this.
To complete his cure, doctors will implant a second electrode on the right side of Greg's brain.
I would assume that the second surgery would be the same as the first. They won't turn it on for 2 weeks, and they'll tweak it, and they'll fine-tune it. And I expect by my birthday or in Christmas, I should be just as good as new. You know, I mean, a pie in the sky, but I really do.